Welcome to Empowered to Grow, the podcast. I am your host, Hanan Al-Basha. Welcome everyone to a new episode of Empowered to Grow in Business podcast. This is your host, Hanan Al-Basha. As you all know, I always start with, I'm very excited. I'm very excited about the show because my guest today, Amr Metwally, not only is one of the experts in the healthcare and the health tech industry in Qatar and in the region. He's a very busy man and he's usually out of town, and I'm trying to chase him for months. And I'm so happy today I landed him. Hi, Amr.
Hi, Hanan. That's the rumor, by the way. I'm always here.
Okay, I'm putting out rumors about you in front of you. I see you once every few months because you're always so busy. But thank you so much for being here today, Amr.
Thank you, Hanan. It's a pleasure. Following a lot of your episodes. I like really the discussion, how live you bring a new insight. So I'm looking forward to exchange.
Yeah, me too. So, Amr, let's start with you telling our audience a little bit about you and your background, please.
Okay, so my name is Amr Metwally. I'm been in healthcare for more than 2 decades right now. I've been started a bit of different roles, so I'm not necessarily having the same constant role all my experience in healthcare. I've been taking multiple roles. Started by healthcare planner, and then later for working in the management and operation, and then construction management even. And right now, ending with I'm co-managing Itqan Clinical Simulation as Director of Innovation and Assistant Executive Director. And this is, I think, where I'm embarking for almost 6 years right now. Yes.
Wow. Okay. And Itqan was, along with Qatar University and Qatar Development Bank, you were the ones that did the first Qatar Health Tech Hackathon.
Yes.
That
Yes.
was amazing. I was a mentor in it, so I really loved
Yes,
it.
it was a pleasure to have you in Itqan. Itqan is a great concept, really, and the growth is exponential, really. And we have a very good support by the government, by all entities. I think this is what Qatar needs as a platform for health tech innovation, because currently, like any other country, there's nothing right or wrong, but fragmentation is one of the things that really, if you describe healthcare, it's a severely fragmented. So similarly, health tech and innovation. So I think Itqan can do somehow uniforming role.
And I love that. And I love that you started with, what's on ground. Now, healthcare is something that every person around the world deals with. Healthcare systems, we hear the complaints. We also hear about the advancements and stuff. Usually the advancements are in the kind of the entities or the hospitals or that become corporations that invest a lot of money, as you said, for the innovation part, for bringing cutting edge solutions and everything else. But now we have technology that is a lot more accessible than it used to be 10 or 20 years ago. Let's talk about that first. How technology, before we go into the health tech, as in the when we say health tech, just to clarify to everyone who doesn't already know, it's tech-based or tech-enabled startups in the healthcare industry or supporting the healthcare industry. But let's talk about the role of technology. How are you seeing, from your perspective and your experience, how are you seeing technology supporting the healthcare industry over the past 10 years?
Let's agree on one basics here, really, is technology is here, right?
Yes.
And when you are asking me for technology, I have to define 2 technology ground. Technology that me and yourself, we are having an access for. It's like ChatGPT. And this might be free, might be modest, might be quality accepted or not. No one care really, because I'm not a highly business holder or anything like that. And the technology that I don't have an access for. And this is, I think, what healthcare community is looking for. And this community where Elon Musk using to develop
Neuralink and
rockets, right? When Microsoft they develop a controller for their I don't know, PlayStation or whatever. I don't have as of today, and I'm not telling here in Qatar. I'm telling globally. I'm very well connected with most of the global institutions, and I don't have access to that, right? And the more problem that this technology holder or whoever hold this deep tech technology, they are not also interested in healthcare. They have a very good ground in basic and space. They can see it in hospitality. For them, healthcare is very complicated industry, and they do understand that at the end of the day, healthcare presented maybe by hospital or clinics, they are not the real buyer. We are just platform that the transaction will happening. So maybe they can go and support something else in the domain of the healthcare, but not necessarily the hospital. And this is where we're lacking. We end up sitting within startups, which is something great, but they are trying, they are testing, they are doing things that is not necessarily matching the way we do our work in the hospital. So technology indeed is important, but which technology that I'm having an access to? That's the main question.
Okay. Now, as you said, there is technology like, the deep tech we might not have access to, but we have seen a lot more accessibility towards technology that supports let's call it the everyday patient or the everyday hospital and clinic. We are
Yes.
seeing a lot more when it comes to diagnosis using, high tech or cutting edge tools. We're seeing robotics come into the operating theater. We're seeing, technology being used to share data and research across the globe. These are things that are, would you say this is a space where more health tech startups could have an impact in?
The problem is that this domain is monopolized basically by the big industry names, and they left most of the pieces. I think, to be honest, the mistake is not from the hospital, is not from the healthcare. Healthcare is the most fragmented industry at the moment. It's a very bureaucratic industry. They don't
Yeah.
want to change because we already congested with waiting lists, with less resources. And we know today, we thought that we are lacking 20% from physicians and nurses worldwide. However, during the COVID, we came to know that actually we are lacking 50%, which is a disaster.
Wow.
We know it by
Yeah.
the wrong by the wrong time with the wrong
Yeah.
pandemic.
Yeah.
However, this is the fact. So basically, you are talking about industry that they don't want to change. My experience as a healthcare leader or executive, basically, because I'm doing the same thing every day for years.
Yeah.
And this is how I've been strong. This is how I make everything smooth. Come today and tell me you have to change, you have to try new tech. I will tell you, yes, I might be having a mindset to change, but the problem, as an example, the startup will come and sell me the tech or the health tech. The procurement process itself in the hospital, we are talking minimum by 12 to 24 months. So for
I
God's
know.
sake, which startup they can come and make you a
They
proposal?
won't survive.
It's
They won't
exactly.
survive by the time you buy their solution.
It's absolutely impossible. The problem also that startup they come and tell you I having a very cool tech, but the problem this is a trap, and for hospital and for the startups, because basically what they do, they are coming to a very niche problem, a very cool problem. It's a look niche, AI integrating booking system. This is not my pain. My pain
Mm.
is really more simpler than this. But the problem startup, they like to go for benchmark, for the niche market. As an example, startups in healthcare in Qatar, I never seen what the most segments that everyone should be go and focus on is the blue collar. There is
Yes.
it's surprisingly in the last 3 years I did not see anyone as targeting business as a business target or segment is the blue collar. Everyone is going for a high niche market, which we are not interested in this. No one is interested in this. Who said that the doctor will love the tech? It's completely absolutely delusion, and it's a big myth there, right? Doctors they
Yeah,
get their experience from doing the same thing for years.
I remember reading about kind of the attempt to integrate EMR, which is electronic medical records, just to get doctors to see more patients and to be more efficient and stuff. And I remember it
Yes.
wasn't just about Qatar, even in the States and worldwide, it's like, I don't want to do this. I was like, but it will help you and do your job easier. But as you said, I think it's part of their concern. Well, let's look at the stakeholders. It's the doctor and the patient, and then there's the hospital as the management or the clinic or whatever.
Yes.
the doctor is concerned with the patient. They want to make sure that they diagnose them right and everything else. But that part, if they don't get that diagnostic information into somewhere that will be stored so they know for reference, then they're not, they're losing a lot of data.
Yes.
But if they do that, then they're losing a lot of time because they're not used to it. But this is where healthcare, or at least health tech companies could support. It's, we're talking about AI now, and this is where AI could support. It could be voice transcription, it could be, short notes, it could be something easy that could be done, and especially that blue collar kind of segment, because we are looking at 1.5 million just in Qatar.
True. Amazing. Imagine, it's almost half population.
Yeah. So something to facilitate the healthcare providers for them, that is a lot more efficient than, because I know one of the startups I advised was a diagnostic tool using AI for, I don't know what, and I'm like, okay, that's cool. But as you said, it's very niche, looking at
It
the
is.
percentage of its usability in the everyday life.
Mm. And to close one deal, probably you need like 12 months. So once you do that with a niche market, how many patients you will see in these segments? And at the end of the day, the miserable situation that hospital is just the platform. Whoever is controlling the transaction is neither the patient nor the hospital. Is actually the insurance company. An insurance company, they have their own games. So come and talk to me about EMR, which every day I'm being offered a solution as EMR in the hospital. Insurance, they don't care. They just simply don't care. We want to do our job to reduce the cost. That's it. So why you are not focusing on the main pain? Why you are not coming in with us, live with us, see what is the really most pain that we are facing? How many times you have seen AI replacing radiologists, right? And then they come and offer this to a radiologist. So what
Can I
face
offer
do you
you to
think?
take your job?
What is exactly? And the problem hospital, in case of the medical error, they need something physical to put in the jail or to go and take it into the court. AI is not a physical entity. So basically, there is a lot of struggle. The system of healthcare is yet to maybe evolve. Once it's automated, then you can engage. But the problem, what's happening, you have a full flow that is totally in analog. And what we are doing, basically, we just come in a piece of it and we say, I will automate that. Why do you think that this will help the whole flow? It's like I'm taking the fast train in Europe, and then between the station, I go and walk. It is absolutely, sometimes it's good, sometimes it's work, but most of the time, I've seen myself, it doesn't work.
Okay. We were supposed to talk about building impactful health tech
We,
startup, and now I'm
we
like,
can, we can,
where
we
do we go
can.
from here?
We
Okay,
can.
so let's take a step back.
Get it.
To build an impactful health tech startup, you're, being on ground, you are saying they have to go and live on ground to
Yes.
see who are the biggest stakeholders and where the bottlenecks are and where the pain points are, which is exactly what we tell every startup founder: find the pain point so you can find that solution. But most of the time, it is not about the actual healthcare, let's call it procedure, or kind of closed loop. It's about the ecosystem, the bigger stakeholders, the insurance companies, the hospitals, the healthcare centers, the infrastructure that supports the end game, which is the doctor seeing a patient.
True. And I'm totally agree. Unlike that, you refer to an ecosystem, right?
Yeah.
The main pain that I've seen myself right now, and it's considered as a big gap, is actually outside the hospital. So the hospital system itself, for many reasons, is become like a black box. So if you manage to get the flow, if you manage to get the revenue going on and the cash flow, there is none of the hospital admin or management or the owner or the stakeholder are interested to change this. They wanted to keep as is. So if you found gaps in the hospital that it can solve a real pain, go ahead with it. If you want to come, we are not talking about AI here as a replacing doctor. We are talking about AI as an example, as a co-pilot. So he's not the main pilot, he's not the autopilot.
Yeah.
So he's co-pilot, he's helping the doctor.
Yes.
The regulation is the regulation. I cannot get around the regulation. And I've seen many technologies, they come and they tell you, okay, but we're still in phase one in FDA. This is a death trap. FDA is a death trap. Don't go for something technical and then equipment and trying to sell it in a hospital and waiting for the FDA to be done. This is a lifetime situation that maybe I will end the whole money cycle and I didn't see it FDA approved. So it is a real problem. You want to focus in the ecosystem. Hospital itself, by the way, it's very good within the hospital setting. To, as an example, many of diagnostics we do, many of the data collection we do, we collected within the hospital settings, which we do
Yeah.
understand today the revolution of the healthcare. I'm having my smartwatch. Imagine that
Yeah.
this is 24/7 collecting data that hospital doesn't have access to.
Yes.
Imagine how, if I'm going for a doctor and he collecting this data, how to collect the external ecosystem to the hospital. Most of the startup at the moment, they focus to change the hospital inside, and it doesn't work. Hospital is one small element in the ecosystem. Change the whole ecosystem, and hospital will follow. Which
And
I
I
know
love the
it's a
fact,
weird concept, but
yeah,
it's the
yeah,
right
but
thing.
deal with it from the outside inwards rather than from the inwards outward. Um,
Yes,
and I love the fact that you referred to the technology and AI specifically as being the co-pilot because for us, Liman, of course,
yes,
and having a discussion with him, and we were talking about AI and the applications of it, and he referred to it in the healthcare industry, how it could support or revolutionize the healthcare industry by being the co-pilot with the doctor, by
yes,
bringing up the health records and all the diagnostic tools and history of a patient to be able to support the doctor to make a more accurate prognosis and treatment plan. And this could work. It could be, as you said, within the operations of receiving people, doing triage and all of this. These are elements that where we're seeing a lot of the health tech companies focusing on. But I think what you refer to is really, really important. It is not trying to change from the inside out because that takes a lot of time and there's a lot of resistance from a much bigger bureaucracy, but looking at the pains outside to be able to service inside better.
yes. If you split the percentage of the sellers within healthcare community, you would see that maybe 30% only the hospital. The much larger part of the cake, it's actually by both insurance and consumer, which is the patient here. So
Yeah.
don't try to sell to the hospital right now. It's a very long cycle. It takes time and it's too difficult to try and test, and the cash flow is not that fast. Go sell it for the consumer, for the patient, because the patient, as an example, why you are selling EMR to the hospital? Sell a wallet for e-health wallet as an example to the patient so he can have his own data with him in his mobile app or anything, and I can tell
Yeah.
you that will be a way more successful. At the end of the day, how many hospitals in Qatar or how many hospitals worldwide, but how many patients we have, how many people they traveling from one place to one place. I've read an article a few days ago that the tourism is expanded like 15% last year from the year before. It seems that this is amazing encouragement right now people to go and travel and make tourism. While I'm traveling, I need to have every single information with me. So imagine right now, like I'm having the credit card with tapping in. I need to do something like that. I never seen a solution like that. People focus
But
on
but
EMR.
But that's the point, Amr. I've seen startup founders trying to create these solutions, and they faced so much resistance
Yes.
by the hospitals that
Authorities.
will allow them to hook it up, the doctors and the clinics and the private clinics that will allow themselves to input again, going back again. This is again, it needs to be hooked up with an EMR at the end, electronic medical records, that they will input the data so that the patient has ownership of their data. This
Yes.
is a big issue.
It is. It is because we are in a big debate. You will not ask anyone in the healthcare community about that whether the patient has the full rights to have access to his health information. No one will tell you no. However, the practice and regulation is actually preventing the free flow of healthcare information. I've seen several startups myself. I did work with them and mentor them that they are making a platform where you can access the healthcare from any place in the world. And their problem was that they are not able to connect each country with this platform, and because many
Exactly.
regulation is stopping that. But I think this is strength. This is evidence to my say not against it, because again you trying to link this to the hospital. But the
Okay.
situation here, as an example, it's a wellness. Let's say it's a preventive medicine. It's about connecting to the triaging, to the clinics, to telehealth. Try to create like exactly what's happening with Uber.
Hmm.
Uber never come to the taxi transportation or traditional governmental transportation and they offer them help. We will offer you. No, they actually did do what? At the end of the day, they make a full ecosystem, parallel system that is parallel to the traditional transportation system. And once it's done and there is a big decline, the transportation system, they came for them and they say, help me. Now we can see that taxi, normal traditional governmental taxi, you can call inside the Uber. And I think it's
Hmm.
the same. If you create an ecosystem for health and wellness, parallel or complementing what the hospital do, at some point the hospital will have nothing to do except to come to this ecosystem. But the problem is trying to build an ecosystem with the current hospital sitting system, which of course they are resisting.
I love that. So it's being disruptive without disrupting.
Exactly, exactly. Because you don't want to be disrupt the healthcare system, right?
Yeah.
We've
You
seen
want to
it.
support. Actually, at the end of the day, you do want to support them. You want to
Yes,
make it better because, as you said, we're talking about 8 billion people around Earth and 8 billion people in the healthcare, kind of
yes,
segment.
yes.
So you really do need to find a lot of solutions. And and talking about a globalized world we live in now, we have to have this integration. It's not an option anymore.
It's not an option. And the problem with healthcare system is integration. So
Yeah.
today, when I'm receiving patient, I take the patient, I put him in every single tier in the hospital level, emergency, patient, primary care, secondary, tertiary, until I know what is his problem, and then I solve it. And this
Yeah.
is money burning cash for
Of
this.
course.
So
Yeah.
how I can find way to get the patient directly to the right tier? I cannot see any solution other than technology to do this. And this is a real pain for the hospital. The system, especially the public system, is bleeding because of the much expense of the money against the directing the patient to the right tier.
And this, okay, I don't know if you know this, but after I completed my doctoral studies in business, I
Yeah.
decided to go into a health coaching certification for a year.
Okay.
And the essence of it, health coaches are supposed to support your wellness and your happiness. We're not medical professionals in any way, and no one claims
Yes.
to be. But I love the fact that we can dig into wellness and looking at the different aspects. And
Yes.
one of the things that came up during our study was the evolution of functional medicine practitioners. That's exactly what you're saying. And what functional medicine practitioners, and they have to have a medical background, is they stop being specialized in one thing. It's not pulmonary disease or it's not, cardiac or whatever. It's going stepping back and looking at the person as a whole and looking
Yes.
at the symptoms as a whole and then finding the connections. Like I had shoulder pain and I realized that's actually because of my neck, and my neck is because of my stature, and my stature is because of my migraines. These kind of things. It's looking at the person as a whole. And I think this is what you're referring to. Rather than be just focused on the certain things, take that functional medicine practitioner perspective and look at the patient as a whole, the ecosystem as a whole, and see where you can connect the dots to relieve the pain points from the
Yes.
flow.
Yes, and I really fond with this because the essence of hospital is actually to keep patient away from the hospital.
That's
And the
true.
problem, what's happening basically, that we forget this very normal or very simple basics, and we started to attract. And in fact, not only that, we started to build hospital-like hotels, improving healing environment. Or, however,
Yeah.
actually, this is against the essence of the hospital. I remember very well 10 years ago, I was presenting in a hospital, in a very a great international hospital design. And I was presenting the healing environment and how really the hospital should be built as an hotel. And one of the practitioners, he come and he asked me, you know what? what you are asking for or what you are calling for, it's totally against what we've learned in the hospital, in the universities, is
Yes.
actually make the hospital as a primary setting, ambulatory care, receive care and go home. That's it. It has to be
Yeah.
fast.
Yeah,
So I
but
totally agree with
again,
you.
we have changed as well, and
I think
people
so.
have changed, and they want to pay a little more to have that private suite, to have the
Yes.
luxury, to have this.
Yes.
Unfortunately, again, everything can be, you have extremes, and this is another thing that breaks my heart within the healthcare industry generally, and again, this is global. You have the extremes. You have the hotel like hospitals that you actually enjoy going to, which you shouldn't, because you shouldn't
Yeah.
enjoy going to the hospital.
Usually,
And
exactly.
exactly, and you have like the bare minimum clinics serving a lot of people in areas with a lot of economic difficulty and everything else.
True.
And I
True.
think finding that balance in the middle, and again, going back to health tech companies, how can you support that, bridging the gap between having the innovation here to support, not necessarily to make it hotel like, but to be able to support the service, the quality of the service, and everything that comes out of here, and making sure people over here don't overstay in hospitals because they're enjoying it and they're getting great
Yeah,
service.
yeah, yes, yes. I totally agree with you. And actually, I was presenting an innovation in healthcare 2 days ago, and I gave them a very provocative questions. If you have an AI tool, and this AI tool, it's come up with a 90% accuracy, and you have a doctor that general accuracy for the doctor's physical doctor would be probably 85%. Which one you would select? And everyone, of course, said, I will go with the 85% because it's a physical. They want something to just get guilty with, right?
Yeah,
And I told them,
yeah,
okay, let me ask you the same questions because this is something I lived myself. I was in one of the African country for some volunteering charity projects for healthcare there, and I get diagnosed with malaria, and it's there is no hospital, there's no much clinic, and I couldn't find anything other than an AI diagnostic tool. You use it to just check the retina dye because you know a lot about your health issues from your eye, right?
yeah.
And I've been diagnosed with that. I'm fully trusted. It was for me, it's a flipping stone, really. I having malaria or I don't have malaria, and I took medication or I don't take medication. And
Mm,
for me, I asked him this question. Okay, in this case, they totally rejected or declined to go with an AI. But in this case, in this situation that I live, your AI is the best solution, really. So for me, as an example, to improve accessibility for the countries that in war or under conflict or very poor healthcare quality, technology is the best one actually can improve that. And I've traveled myself in Rwanda from a civil war where 800,000 has been killed, over 2 million they left the country. In only 10 years, they managed to get a very good high quality system. How they did that? Through a technology.
I
That's
love
the
that.
only solution.
And this is the impact we're looking at. This is
Yes.
where the health tech companies could be looking at a lot of alignment with the United Nations Sustainable Development Goals and everything else,
Yes.
and seeing how to bridge those gaps. I can't leave you without asking you about the other part of the healthcare industry. Now, we were looking at the practicing side, the hospitals, the healthcare centers, and all of this. What about the research part? Because we know that there's a lot as well within the research. How are you seeing, or where are you seeing the areas where health tech companies, health tech startups could support a lot on the research end of the healthcare industry?
Very simple, Hanan. If we are not counting on AI, we would still be under COVID right now. If we follow the right situation for how exactly to develop the vaccine, this is a 2 year cycle minimum. What's
Yeah.
happening basically that they started to engage AI and they get more scenarios. They started to get digital twinning. For me, as an example, I guess this is what I'm working in at the moment is digital twin. It's accelerating research, sequencing, and I was discussing this morning in some research department here and integrating the AI. It's quite amazing. 2 days ago, I was presented by a startups. Imagine what he's doing. So he making the sequence of the genes, gene therapy, and
Yeah.
he's making as a games, and he has 2 million gamers. So what basically do the gamers, they go and make this matching sequence because it's a game, right?
Yeah.
Once it's done and the sequence is done, it goes to the research department, they test it, and if it's working, if it's not. So rather than I'm sitting in a PC myself or asking the AI, it's a gaming. So imagine how amazing something like that can be done. For me, the whole research of the healthcare, I think this is what we are facing currently, is being disrupted very soon. We even started to hear things from FDA that they started to change their cycle, and they start to change the regulations so it becomes shorter if you come up with an AI. For me, healthcare is still not in disturbance mood. I wouldn't say that we are disrupted much, but in my opinion, we are living right now very close to disrupt the whole research in healthcare. And
I
thanks
love that.
for the health tech.
Yeah, and I love the fact that gamification has found its way to research in the healthcare industry.
Exactly, right. It's like 2 million gamers. They already register in their system, and they keep playing all day and nights, and goes to the sequence at the end. Amazing idea.
And that's a fascinating thing, and this ties back to what you were talking about. It's the matchmaking, how and what kind of groups or segments or groups of data even that you can bring together to be able to get a holistic solution that's expedited and can serve a bigger population.
True. And probably, if I can predict today, I would say that the healthcare will be disrupted by sharing economy concept.
Mm,
Doctors and physicians and nurses, they started to get and provide care outside the hospital because this is more lucrative for them. It's just a pure regulation issues, but let's go back again and use Airbnb or Uber.
yeah,
Initially, it was against the regulation. However, the regulation has to come and just do some matchmaking. So let's some negotiation agreement. I do think this is the right way. I do remember very well one of the app is very famous right now and is one of the unicorn in US. When it started to regulate or make matchmaking between nurse care, home care basically from nurses to give care inside the homes for some patient, it's failed miserably. Once making an open platform that if you are a patient and there is a nurse and we are making matchmaking, in 1 year it's become a unicorn. And I think one of the most influence right now in the healthcare is the sharing economy.
I love that. Amr, thank you so much. I think there's a lot of
Thank you.
food for thought for any of
Yes.
the founders that are watching today that are interested, that are either building or interested in building a health tech startup. My last question to you is one I
Yes.
ask all my guests, and that's empowered to grow. Like that's the name of the podcast. But how does this phrase resonate with you personally?
Empower to grow.
Yeah.
For me, if I'm saying something is monetize from day one. I did this mistake in few startups, and it cost me that um, almost close or bad experiment or stop the startups or exit or decline.
Mm,
Monetize from day one and build on what you have. Sell to the right consumer. Uh, and if I want to say something, I would still say empower the technology because I do believe that this is the wave of the change. At some point, the healthcare will not be standstill or strong enough to cope with that. At some point, healthcare will have to knee and accept the technology as is.
I love that. Amr, thank you so much
Thank you,
for
Hanan.
being my guest
Really
today.
enjoyed.
Thank you. And I look forward to seeing you in person soon
Of course.
in Doha.
And don't spread the rumors. I'm here in Doha. I'm not going anywhere.
Always a pleasure to talk with you. And I hope everyone who watched this today gets a lot of value from the conversation. Amr's insights on looking at the ecosystem of the healthcare industry and how you can create a health tech startup that has massive impact, that looks beyond just the day-to-day operations, or maybe starting from the day-to-day operations and looking at the bigger picture, could support a lot of people around you. We keep talking about the ripple impact effect, and I believe that every one of you is able to do that. As always, thank you for joining us in Empowered to Grow podcast. I wish you love, abundance, and prosperity, and I look forward to seeing you next time. Bye.
Thank you, Hanan. Thank you all.
Thank you for listening to the Empowered to Grow podcast. I'll catch you on the next episode. And until then, know that empowered you empowers others. Love, abundance, and prosperity to you all.